Hi, Tara.
Hi, Tara.
Hello.
Hi.
I'm not sure who I'm talking to right now.
The male voice is Dr. Leonard Friedland, and I'm here with Anne
Okay.
Geddes.
Okay. I didn't hear a female voice, that's why I was confused. Hello, Dr. Friedland.
I'm here. I'm here.
Friedland. I'm sorry, Friedland. And I'm sorry, was that Anne right there?
Yes. Oh, you can't see us?
Okay. Yes, I can hear you. To make it a little bit easier, I was probably just going to do, talk to one of you and then talk to the other, but obviously either of you could jump in if it seems appropriate.
Okay.
So I was going to start with Anne, if that's okay. I'm going to use some of the questions that they sent us as prompts, but I also had some additional questions. What inspired you to get involved in advocating for vaccinations in general?
Well, for the last few years, I've been the global advocate for the United Nations Foundation Shot at Life initiative, which aims to get vaccines to children in countries where they're most needed. And it's not necessarily common knowledge that globally, one child dies every 20 seconds from a vaccine-preventable illness. And I think that's totally unacceptable, as do the people at Shot at Life. So I'm a huge advocate for vaccination.
Do you have any thoughts on some of the vaccine hesitancy that occurs in the United States and in other places? I mean, what would you say to a parent who was uneasy about vaccines or had some concerns or fears?
Right. Okay. So I'm sure our good doctor here can address this in even more detail, but let me tell you, anyone who has doubts about vaccines, go and have a look at these 15 survivors of meningococcal disease and then have a think about whether you want to change your mind.
What led you to focus on meningococcal disease instead of another one? It's not one that I think a lot of people really know about, or maybe that's the reason. I don't know.
Well, you know, it was interesting because when I was first approached to do this series of the 15 survivors, it took me back to when our girls were young and at school and going off to college, and there were some cases of meningococcal disease in Auckland in New Zealand, which is where we were living. And thankfully there was a lot of press coverage of some of the victims and the symptoms and so on, and so parents could be vigilant, which we were, and a lot of our friends were. And so to be approached to do this, to raise awareness, made me feel as if I was giving back to this generation of parents, and particularly at this time, the parents of the youngsters who are going off to college. You know, it's a busy time and it's hard for them to leave the nest, but this is a very, very important time to make sure your vaccinations are up to date.
When your girls did go back, did you talk to them about the disease when they were going off to college?
I'm sorry, the volume's a little...
Oh, I'm sorry.
Can you repeat that question?
Yes, when your girls were going off to college, did you talk to them about meningococcal disease or how they could protect themselves or the symptoms or anything?
Yes, well, how to protect themselves, certainly, because a lot of meningococcal disease is spread by sharing drinks and all the things that teenagers do, you know, and particularly college students. So what we're trying to do here is raise the level of awareness of this so our children are informed when they do go off to college. I think it's very, very important that this discussion happens at home with the parents, because by the time they get to college, you're not there, and they need to be able to recognise the symptoms.
What about a parent who doesn't know how to start? What would you, like, how should they start? Like, hey, let's talk about meningococcal disease. I mean, do you have any suggestions for, I guess, the first part of the conversation?
Yeah, you know what? I've been photographing babies and young people for the last 30 years, and I'm a mother myself, as I've just mentioned, but I consider myself a visual storyteller. And so maybe you should have your children see the images in this series, because to me as a photographer, it was such a gift to be able to raise awareness of meningococcal disease instantly in an image of a young person with no arms and no legs. Really drives that message home. So that's the way I have been able to contribute to this campaign. And when GSK approached me to actually speak more about meningococcal disease at this really important time of year when our kids are getting ready to go to college, of course I said I'd be here in a second, because it's such an important message. And just look at these 15 survivors and understand that meningococcal disease is now vaccine preventable.
Makes sense. The images, by the way, are gorgeous. One of the people that you photographed is someone that I know, because my thesis for my graduate work was on stories of people who had or had not survived vaccine-preventable illnesses. And Jamie, the student from the University of Texas at Austin, she was one of the people I photographed because I'm also a photographer. it was a master's in photojournalism. Which is why I was particularly interested in speaking with you. But
can I tell you
really
a story
cool.
about Jamie? Would you like to hear a story about Jamie?
Yes, please.
Jamie's from Texas, and she was 19 when she contracted meningococcal disease and lost both of her legs and most of her hands. And if you go to her website, you can see her speaking so eloquently to this cause.
Yeah, well, no, I interviewed her and her mom at her home.
Yeah. So she came to Toronto for me to do the shoot when we were over there. And I was rummaging around in a warehouse in Toronto, you haven't heard this, for props, and because a lot of the survivors in this series actually don't have legs. And so I had them on beautiful pillars to represent a sense of strength and stoicness. And so there I was in this warehouse, and I spotted a bust of Helen of Troy way over in the corner, and I said to the fellow who ran this props house, do you think we could get her out? And I don't think she'd seen the light of day in years and years and years, but to me, Helen of Troy, in Greek mythology, is the most beautiful woman and the warrior princess and so on. And I thought, wouldn't that be fantastic to have Jamie sitting on top of Helen of Troy? So we got a carpenter to build a chair above there, and when Jamie was sitting up there on top of Helen of Troy, I thought, two warrior princesses together, and I think it perfectly sums up everything that she stands for.
Mm-hmm. It's beautiful.
That's fantastic. Yeah, she's a remarkable woman.
Right. They were all 15 of the survivors were absolutely remarkable, and all of their stories are unique. And it's what I think is really important to mention here also is that for every single survivor in that series, there's a family right behind them.
Absolutely. Right, and these are stories that we wish we didn't have to tell. And if we took full advantage of modern science and modern vaccines to protect against meningococcal disease, we would hopefully not have these stories in the future. I'm a pediatrician, Tara, as well as a vaccine researcher at GSK. And I started out my training back in the late 80s, before many of the modern vaccines that are commonly used were licensed. And then I got to witness firsthand the miracle that vaccinations impacted at the patient level and at the population level. And from then on, I said I have to work in the vaccine field because it's just so critically important what can be done through modern science. And it's an honor and a privilege to work in the field and to interact with someone like Anne, who can visually capture these stories. But it's just so important. At GSK, we recently conducted a poll where we surveyed parents and their teenage and young adult children around the nation. And specifically, we wanted to know what their knowledge was about meningococcal disease and vaccination. And over 80% of the parents said that they would like to have their children protected against meningococcal disease, yet only 43% were actually having discussions about what is the illness with their school, their teenagers and their college-age children, which really highlights the importance of having these discussions, understanding how this illness can present, and knowing what the options are for meningococcal disease, both for the ACWY, for which vaccines have been available, as you know, since 2005, and more recently the 2 vaccines that were licensed to protect against B. So there's a lot of new science and new opportunities to protect against something that, we would hope that we're not telling these stories in the future.
And I heard such harrowing stories, and a mother standing at the end of her child's hospital bed screaming, "Don't die, don't die." And meningococcal disease comes on so suddenly, and your child can be dead within hours. And another parent saying every time their daughter came back from surgery, there was less and less of her. This doesn't need to happen to your children, and these 15 survivors in this series have put themselves forward to bring that message to the public. This is vaccine preventable now, so how could you let this happen to your child?
Yeah, and these vaccines, I mean, these are really modern vaccines. They're a triumph of understanding of biology and immunology, particularly the meningococcal B vaccines, the two ones that were recently licensed. We couldn't have vaccines that were safe and effective prior to today for meningococcal B, and we've been able to crack this egg with a safe and effective vaccine. So there's so much opportunity, and it's really important that parents understand what's available and speak with their healthcare providers about what are the options, and look to give the maximum opportunity for protection for their children.
Speak to your college-age child too, because they need to understand the symptoms. You're not going to be there if these symptoms come on. And also, I was thinking it will help to protect their friends because they will recognize it in each other.
Right. Knowledge is important.
Very much.
What surprised, this is a question for both of you actually, what surprised or concerned you most about the survey of U.S. parents?
Well, I think for me what's surprising is that more than half of families are not having discussions with their children around meningococcal disease. And I think there's probably the rare family that's not heard of some of the outbreaks that have occurred in the last few years across our nation on college campuses. But yet there's only 42% or 43% were having discussions with their children about this. So I think that is surprising, but it's also an opportunity. We want to take it and say this is an opportunity to highlight how important it is to have these discussions, and particularly this time of year. As a parent myself, school is ending right now for college and for high school, and we always look to the summer to say what can we do to sort of get everything ready for the fall. And on the list should be, are our vaccines up to date? Are our children up to date on their vaccinations? Let's get those appointments in, speak to the doctor, and get everything ready for the fall, because otherwise the summer's just going to slip away.
Yeah, and I know that you're a photographer and a photojournalist, and I'd just like to mention that, you know, when I first became interested in photography, I was fascinated, I'm going to show my age now, by Life magazine when it was in its heyday, and the beautiful way that photographers were able to tell a story just through a single image. And I tried to touch on that with this Protecting Our Tomorrow series, like a single image of young Jamie, for instance, you know, sitting on top of Helen of Troy with the loss of her legs and her fingers and everything that represents. The story is right there. It just really needs no words.
You kind of just answered one of my other questions, actually, because one other question I was going to ask you, Anne, was the challenge when you're working with survivors of something that have physical effects from those, how you can, like, what inspires you in those arrangements, and how you can balance revealing the person and their beauty along with the effects of what they've suffered from the disease. That striking that balance, I guess.
Yeah.
How do you, does that make sense?
Yeah, it does. One of the wonderful things about children and young people is that you know, they see things in a different way. They have this inner energy and this inner spirit, which is what I love about New Life. That's why I photographed babies in particular for 30 years. And, you know, these survivors ranged all through different ages, but they all, one of the most interesting things I found about it was that nobody ever quit on me. And when you're photographing children and young people, you know, they've got a short attention span, and it's like, I'm out of here. But
yeah.
None of these 15 survivors ever did that, and they all, even according to their age, actually knew why they were there in the studio and knew that they had a special message to deliver in their own way. And I think each and every one of those 15 delivered that message, which was very, very personal for them.
Makes sense.
Right, and just to add...
Was there anything... Oh, go ahead, yes.
You know, up until just this past year, the vaccines that were available in the United States were to protect against the ACWY strains, and we would hear from survivors of meningococcal disease, from their parents, from the advocacy organizations. You know, when will there be a vaccine to protect against meningococcal serogroup B? Mm-hmm. It was an extremely complicated scientific dilemma to create vaccines to protect against B, but science prevailed, and vaccines now, 2 of them, are licensed by the FDA. And so it's a really proud time that science can address questions that parents and children were asking for. They said, we want a vaccine to protect against B. These vaccines are now available, and the CDC is evaluating the information, and soon they'll make their recommendations. So it's a really exciting time for what we can do with vaccines and prevent diseases, because we just don't want to tell these stories in the future. We'd like to not have these stories.
And it's a really exciting time for me as a photographer to be able to create a series that is so meaningful. And that's why I'm proud to be working with GSK at this particular time of year. You know, we're all talking about school and college kids and everything, but what a gift to me as a photographer to be able to share in these young 15 survivors' lives and speak to their families and hear their stories. And if people want to see the images, you're probably wondering where you can see them. If you go to my website, there's a link there. The images are on my website, and there's also a link, or you can go to Apple iBooks, and it's a free download. The project's called Protecting Our Tomorrows, Portraits of Meningococcal Disease. So you can see these beautiful survivors, see photographs of them with their families, read their stories, and of course learn more about meningococcal disease.
Wonderful. I'll be sure to include a link to that.
Great. That's great.
I had a question for Dr. Friedland. When you were mentioning the MenB shots, the most recent ACIP meeting, they did not recommend it as a routine vaccination. Of course, it's available after the 2 outbreaks at the Princeton and at was it Stanford? I forget now. Or it was one of the UC schools, and they've had it in Europe and Australia for a while. But now that it's been licensed here, I think a lot of people were hoping that the CDC would make it part of the routine recommendations, and yet they didn't. They only made it available. Do you have any thoughts on why they did that, or whether parents should consider getting their, what, I guess, it's kind of a complicated question because I'm trying to get a sense of why the CDC might have done that, but also what parents should do with that. In other words, because the CDC didn't recommend it, does that mean parents should still consider getting the MenB shot? Does that make sense?
Yes, so I'll take that sort of the 2 parts. I'll first start with the parents. So there are 2 vaccines. They're both licensed by the FDA. And parents can speak to their doctors about meningococcal vaccination. These vaccines are available. The Centers for Disease Control, they're taking a very thoughtful approach and prioritizing their approach, because these vaccines were just recently licensed. One was licensed at the end of December and the other one in October. And so the first thing that the CDC wanted to address was the groups at highest risk. So people who have underlying medical conditions that place them at high risk. And they also wanted to address what to do in the case of these outbreaks, because there were outbreaks that occurred in 2014 and we're seeing some in 2015. So the first thing they addressed was the issue of people with underlying medical conditions or occupational exposure and outbreaks. And so they made those recommendations this past February. Their next meeting is coming up in June, and that's when they're going to address a more broad use for routine use across our general population in the United States. So they're taking a very informed approach so that they can make the right decisions based upon the information. And I should say, just to highlight again, these vaccines are available and parents can have discussions with their doctor about it. And that's why this is developing with the CDC also. They're just using this, they're prioritizing their approach, and I think it's very thoughtful what they're doing.
Okay, that makes sense. They're probably doing the cost effectiveness thing. I know a lot about that. Let's see here. And I didn't hear a response from you about what concerned you or surprised you most about the survey of U.S. parents.
What surprised you, if anything, about the survey?
What surprised me was, what I really wanted was for 100% of parents to be wanting to vaccinate their children, particularly against meningococcal disease, what we're talking about now. The poll came up with 83% of parents really wanted their children to be fully vaccinated. And the fact also that less than half of the parents had actually discussed this with their children. So, think that's very surprising, and I think that one of the ways that I have been able to be so effective with this project is to create these images. So if you're having trouble talking to your children, or you're wondering how to approach the subject, maybe go onto my website and have a look at these images. I'm sure your kids will be right into being vaccinated.
That's a fantastic idea. Dr. Friedland, what are the highest risk groups, just generally speaking? Not referring only to those with underlying disease, but who's most at risk for meningococcal disease?
So if we look at meningococcal disease across our population, there's a risk among very young infants, and then there's another risk peak in late adolescence, early adulthood. And so if we focus in specifically on these late adolescents, early adults, why are they at increased risk? It's probably related to just lifestyle, social situations, crowding, sharing of drinks, kissing, exposure to cigarettes, smoke, both active and passive. So that's why we see a peak in adolescents and young adults. But it's important to point out that while we hear all about the outbreaks on college campuses, 2/3 of the cases that occur in adolescents and young adults are not occurring through college outbreaks. They're occurring sporadically in our population. And it's important to say this because it just says it's unpredictable. We cannot predict who is going to come down with meningococcal disease. And that's why vaccination is so important, because that's our best tool, because the disease can come on very suddenly, and we can't predict who's going to be impacted. And vaccination is our best tool for prevention.
Wonderful. Well, thank you very much. I really appreciate the time both of you have given, and I will. Well, I guess I'll be in touch with your agents, and they'll see once the articles are up, which will probably be next week. So.
Great.
It's a pleasure. Thank you so much.
Thank you.
All right. Thank you both. Bye-bye.